Okay, it's 12:01. I want to make sure we have as much time as possible for our conversation today, so I'm going to get us started. So welcome to Mind, Body, and Spirit Life Cycle Care for the Whole Woman. This program today is brought to you by Northern Westchester Hospital and Phelps Hospital. My name is Stacy Isaacson. I'm a member of the community health team at Northern Westchester Hospital. Thrilled to be here today with the Center for Healthy Living. And I'd like to give the warmest welcome possible to our panelists today, midwives from the Northwell Midwifery of Harrison, Kathy and Michelle. I'm going to ask if you don't mind just introducing yourselves briefly, because you'll do far better than I could. So Kathy, if you want to start us off.
Sure. Thank you so much for having us. I started our midwifery practice back in the year 2000, so we've been around a long time. First is Full Circle Women's Health, which some people in the community probably still know us at, and then we joined Northwell about 3 years ago. I've been a midwife for 35 years, and I have a special interest in GYN as well as OB/GYN care, so I'm excited to talk to you all about that today.
We are thrilled to have you, and personally I can't wait to hear everything you're going to tell us. And Michelle, if you don't mind introducing yourself.
Sure. Hi, my name is Michelle Lamer-Chafulio. I joined the practice in 2010, so that's been about 12 years now. And at that time I had a 1-year-old and a 5-year-old, and now they're 13 and 17. So as my patients had babies and grew up, my kids also were growing up, and now I find I'm much more of like an aunt to my patients than like a sister. But it's been a real growing process and learning process to be a part of this group, and I love learning from our patients. They've taught me so much over the years, and it's really a privilege to be able to do this kind of work.
Fantastic. I'm so excited about this whole life cycle care that we're talking about today. So in the interest of that, we'll be discussing life cycle and holistic approach to women's health and well-being, and how a midwifery practice differs from the traditional obstetrics and gynecology that folks may be more familiar with. So through this webinar, we'll explore the gynecological needs and an integrative approach to care for each age group, including sexual health and functioning, mental well-being, pregnancy and postpartum care, and of course, menopause. Breathing exercises for stress management will be demonstrated, which I think is going to be crucial for all of us who are here today. So some quick business. As time permits, at the end of the program, we will, of course, take questions and answer everything that we have time for, including if there are any pre-submitted questions from registration, which I will check on. Please do put all of your questions throughout in the chat or the Q&A function. I am going to be doing my best to keep an eye on that as we go. So Kathy and Michelle, please don't mind if I jump in with something that I see in the chat that may be relevant to what we're discussing. And at the very end of the webinar today, there will be a survey that pops up on your screen. We would ask, please, that you do answer that. And it will also give you the opportunity to put in any questions that haven't been answered so that we can contact you and get those questions answered for you. And of course, if you're interested in making an appointment, we can do that as well through that survey piece. So business behind us, let's get started. So I'm going to start with some quick polls, true or false, just to kind of gauge what we're all thinking while we are here. So I'm going to launch those right now. All right, so you can give me a thumbs up if we see those on the screen. Okay. So, true or false, midwives are nurses. True or false, midwives aren't as safe as doctors. True or false, midwives only deliver babies at the home. And true or false, insurance doesn't pay for midwifery care. So really running the gamut here, right, on what knowledge we come to this with and what we want to know. So I'm going to leave this up for another minute while people are reading through all of these. And then we are going to answer these questions throughout the program rather than sitting and going through all of them now. but I'm going to give one more minute to work through these 4. One good thing about technology, right? It's kind of neat that we can see this happening and I see responses rolling in. All right, we're very close to everyone having participated. And I do want to make sure we have time to answer these questions. So I am going to take this down. And let's jump right in, if you don't mind, Kathy and Michelle. So Michelle, I'm going to start with you. What is a midwife's scope of work and how do midwives practice life cycle care?
Right. So in different states, midwives are regulated differently. So I'll just talk about New York. In New York, you find licensed midwives. And so not all midwives come in with a nursing background. For instance, I had a bachelor's in business economics and then joined a group of other midwives, some of which were nurses, in a grad school program and got a master's in midwifery. So many midwives do choose nursing as a bachelor's and then move on to do the higher level schooling to get their master's. But at the end of it all, we take the same board exam and then we have the same scope of privileges. We can prescribe medication. We're considered independent practitioners. And then our expertise is really in women's health. We do basic gynecological care, so anything from pap smears and birth control counseling. And then we're considered experts in prenatal care and labor and birth management. So that's what most people know midwives to be about. We do deliver in a hospital, our particular practice. So midwives can deliver in the home, hospital, birthing center, but the majority of midwives in the United States deliver in the hospital. And most of them, there's a lot of lower income status kinds of clinic-based care that midwives provide all across the United States. But we are more of a private practice kind of setting at Northwell. And then beyond childbearing years, where we also kind of function as primary care for busy moms, we focus on perimenopausal care leading up to menopause and helping people manage their symptoms with that. And then in menopause, helping also to help them with their symptoms and kind of continuity of care amongst all the different doctors that you're seeing at that point in your life. And then in terms of how we practice lifestyle care, for us, it's about the relationship with the patient. And we know that we are so much more than just our medical diagnoses, right? So, you can come to me and say you're having irregular periods, but I'm also going to be then addressing, how's your sleep? How's your work? How's your stress? What are you doing to take care of yourself? Who is nurturing you in your life? And those are the kinds of things that we bring into the discussion that may not be able to be mentioned in other kinds of medical appointments.
So fantastic. Thank you for that overview, because as you said, I think so many people do associate midwifery with one portion of a woman's life, and having that broader understanding, I think, is so helpful. So on that note, I'm going to stick with you, Michelle, for a moment. How does gynecological care and how does the need change through the different phases of a woman's life?
So we see girls starting at age 12, and a lot of times it's daughters of patients of ours that have loved being cared for by us over the years, and then they say, "Oh, I really want my daughter to, get to know you and establish a relationship with you before she, has really intense needs for you." So at 12, at age 12, I'm mostly just, I don't do a physical exam, mostly just talking about our body changes and safety and mutual respect in relationships, and questions about periods and if they have questions about their bodies. And then as they get older and they enter into sexual relationships, we're just talking about birth control, safe sex, prevention of sexually transmitted infections. And then once they're wanting to start a family, we talk about, things to do preconceptionally to prepare for pregnancy and to optimize health in that aspect. And then like I mentioned before, during the childbearing years, many moms basically have time to go to the doctor once a year. And so we just kind of take care of everything that they need at that visit. And, maybe they go to urgent care for like a strep infection or something like that. And then as you're kind of, entering into your mid 40s and the kids are getting older, you finally have some time to, remember who you are as a woman before kids. And now you're starting to enter into all these hormonal changes. And I think it's a really amazing time for women. We're finally kind of coming into our full selves. We know ourselves really well. We're really still, becoming and, realizing who we are. And so we, talk about all that kind of thing, a lot of lifestyle care in those years. And then, as I mentioned, the menopausal years. So many times women in their menopausal years are seeing, 5 different doctors for various different things. And so sometimes I just feel like we function as the listening component of that, and maybe fill in the gaps where there might not be, a continual thread running through. The different doctors aren't able to communicate together as well. So sometimes we can notice things that aren't being addressed. And so that meets a need for women in those years.
So important, right? So many of us do that, where we're having different conversations with different people, and we need that unifying thread who's really connecting all the dots. Thank you so much for that. So Kathy, I know Michelle had mentioned that you generally do have people coming into the practice as early as 12. Is that when you would recommend teens start thinking about their gynecological health?
So that's a great question. And a lot of people don't really know what the current recommendations are on that. So the first GYN exam, including the first pap test, doesn't have to happen until age 21. However, teens often come to us for other reasons, like Michelle mentioned. So before 21, we may see somebody for their need for contraception, or to be tested for sexually transmitted infections, or difficulty with their periods, or they just may have questions about their body and how it works. And not all those issues require getting a pelvic exam. So sometimes people are a little bit concerned. They do have questions and they're a little afraid to come in. They don't want that part of their body looked at yet. And we tell them that's okay. It doesn't need to be unless you have some sort of a problem. A lot of times, as Michelle mentioned, our patients will bring us their daughters to, have the talk. Sometimes they want our help in helping to discuss some difficult topics, and we're happy to do that. Of course, we always encourage them to go back and talk to their parents and get the information directly from them. So GYN health encompasses so much more than getting a pap test, which starts, as I said, at 21.
Fantastic. And so I want to just go back to what you just said in terms of teens coming in, having things on their mind, right? Encouraging them to go back and talk to their parents. Talking to the parents, how do you recommend that parents start a conversation with their children about sexual health and healthy relationships?
I love that question. I've talked about it a lot, actually. What is important for us all to remember, I think, is that kids start learning that stuff from their parents at birth, really. The way that we look at and touch our children, the way we talk about them and their bodies, we're sending them messages about whether their body is good or bad, a place to respect or a place to avoid. We give them all sorts of messages, and I'm hoping that the messages that we're giving them are that their body is good. And then when they get older and they start getting curious, they're going to have questions. And I think it's really important that we remain what I call askable. In other words, our kids know that it's okay to come to us with questions, and that we're happy to answer them. Because if we say, oh, no, we're not going to talk about that, you're too young, or that's not appropriate, or whatever bad messages we send, that's going to shut down their curiosity. Well, it's actually not going to shut down their curiosity. It's going to shut down their willingness to come to us. And of course, we would like to be the first place where they get information. Dr. Google does not always tell the right things, or the kids on the playground, right? So I would say the main thing is just to be open to their question, and then praise them for asking an important question. Don't shame them for having curiosity. They don't yet know, unless you've told them, that being curious about their body and how it works is a bad thing. So say, hey, that's a great question. And let's say you don't know the answer. That's fine. I think it's great to be really open with them and say, you asked a really good question, and I'm kind of wondering about that too. I don't know the answer. Let's go look that up together, and then you can have ready a bunch of books that you bought. You can go look at the books. And then if you're prepared with age appropriate books, it'll be easier to just grab it from the shelf. You've been saving it. And then also, learning happens mostly in those little unplanned, unexpected moments more than sitting down and having the talk, right? So look for those little unplanned teachable moments. Maybe they're in the bathtub, or you're watching TV, or you're at a farm watching animals do what they do. It's great to use those little moments. And I think that if starting from the very beginning, we can just let our kids know that curiosity is good, their bodies are good, they're worthy of taking good care of themselves. And then when they get older, the harder questions start. And this could be a whole nother talk. I'll just leave it with saying that a really important message when they get to be old enough is that pleasure is good, not something to fear, but with it comes responsibility. So you talk about how to take good care of not only your body, but how to take good care of a partner and make sure that you're a good person and respectful to them. So that's this much of that answer. But
we're gonna continue on that, but first I need to thank you because you just gave me a new parenting mantra: be askable. It's such a great way of phrasing that, right? In this and in all walks as a parent. So in any case, I am going to continue because you gave us a good start. So let's continue down the avenue talking about sex. So when it comes to sexual health, when is it important to talk to your healthcare provider about sex, and what should we focus on? This could be at any point in a woman's life cycle.
I think that sexual health, both physical and psychological, is something that's important enough to discuss at every yearly checkup. I always bring it up and ask somebody how that part of their life is going. And if there are any issues, I let them know that I am very willing to continue the conversation and see what I can do to address those issues. And most people will tell me, and I've heard other people say this as well, that they love when their provider brings it up, because it just lets them know that that's something that's, again, be askable, So if you think that you have this question in the back of your mind, you're not sure if your provider is going to be comfortable with it, you're kind of holding back to see, but then your provider says, hey, do you have any questions about sex? People just go, oh, she asked me. That's great. Yes, I do. So I always bring it up. So I just say to everybody else, if your provider doesn't, please mention it. And hopefully they'll either say, sure, happy to talk about it, or you know what, I'm not the best person, but here's who I recommend you talk to. Because everybody deserves to get comprehensive care for all parts of their body. And I don't think we should leave any part out. Personally, I'm very comfortable treating patients with sexual issues, including people who are having pain, having difficulty with their sexual response, questions about their anatomy and how their body works, very basic things. It's amazing how many people haven't had anybody really tell them that information. And then changes that happen at puberty or at menopause, contraception, safe sex. There's so many things in this topic that we talk about with our patients all the time. And we're very welcoming to all sexual orientations, gender identities. For anybody who was born with female body parts, we're happy to take care of them.
Fantastic. What a great resource you are. Thank you for that, and for all that you do for your patients and that you're doing for us right now. So Michelle, I am going to turn us a little bit back towards prenatal care and that part of a woman's life. But I do also want to say, if you ever want to tag anything in, I don't want to leave you out. So anything you wanted to add to the previous question, please do. But what do you think are the key focuses for women to understand about prenatal care?
Well, I mean, Kathy did a great job addressing those other questions, so I have nothing to add. But in terms of prenatal care, you know, midwives specifically have a philosophy about birth that that I think translates across, you know, all of our care that we give. And that is that birth is a physiological event, meaning, you know, our bodies were made to do this. They transform remarkably during pregnancy to be able to accommodate a pregnancy and then birth that pregnancy. And the more we can do to support the body's natural processes, the better outcomes you have. Now, of course, there's sometimes where, you know, it doesn't function as it needs to, but that's the minority of cases. And then there's ways of intervening that can be respectful and still help the woman remain at the center of the event and not be kind of, you know, just bowled over, I guess, by interventions. So in terms of prenatal care, you know, all of pregnancy and birth is kind of about surrender. And if you think about being able to surrender, you know, you're not going to be able to surrender if you are nervous every time you go to your provider's office, or you don't feel comfortable sharing, you know, what you're thinking about, or if you don't have time to ask questions, or if you just, you know, don't feel like your values are in alignment with the practice that you're at. So, you know, we spend a lot of time in our practice focusing on the relationship that we have with our patients. And we feel like that's the basis for our prenatal care and its success, because once you are able to establish a relationship of trust between the patient and the provider, then you can get to the real questions that someone is having, the real concerns, the real fears that are behind, you know, what their actions, and you can really address those things and help someone feel comfortable, you know, making decisions about that. We spend a lot of time talking about shared decision making. So it's not just us telling you what to do, but us acknowledging that you are an expert of your body and that we bring expertise as clinicians to this relationship. And how can we together make decisions that would be appropriate and individualized for you and your family. So those are, you know, kind of hallmarks of how we and midwives in general view prenatal care. And so we thankfully are able to have more time in our appointments with people for them to ask questions and for us to explain things. We try to point people towards a lot of resources that are going to also assist them in having a, you know, a really comfortable pregnancy and birth. So like we have a physical therapist in our office that focuses on the pelvic floor. We have acupuncturists. We have a yoga studio. We refer to chiropractors. You know, we have all kinds of lactation consultants and, you know, people that we know their expertise is going to really help that person, you know, really have a wonderfully satisfying and successful pregnancy and birth. So I think that's the things I would focus on.
Yeah, that's so important, right? There is no healthcare without trust. So I think that's you really hit on that. It's so important. So in addition to prenatal, Kathy, what about postpartum? What's your approach as a midwife to identify and address postpartum depression, something that we as a society really should be talking about more than we do?
Sure. Thank you for bringing that up. It is very important. So first of all, we see patients every day while they're still in the hospital, and we start the conversation then. And well, actually, let me back up. We start the conversation during prenatal care about the postpartum period, and anybody who's already struggling with any anxiety or depression is more at risk of having postpartum symptoms. So we try to make sure that they have the proper supports even before the baby's born. And then going back to where I started, so they've just had their baby and we see them in the hospital every day. And having a baby is both an amazing joy and an incredible stress at the same time. So we acknowledge that. And we discuss their hopes and their fears and their support system. Everybody needs a support system. And we let them know that we are happy to be an important piece of that support system, but we also encourage them to look for who else is in their support system. And then after they have gone home, the classic way to do it in the US is not to see your provider again until 6 weeks, but we think that's too long to wait. So much can happen in that 6 weeks, both physically and emotionally. So we see patients in our office at 2 weeks postpartum, and that's mostly just for a psychological check-in. How do they feel? Are they eating and drinking well? Are they sleeping at all? How is breastfeeding going? Are they feeling overwhelmed? Do they have enough support? And we have a network of mental health professionals who specialize in postpartum, as well as postpartum doulas and lactation consultants who we can refer our patients to if that's the support that they need. And then, of course, we also see them for their regular 6-week postpartum checkup, and that involves a full physical exam, as well as another psychological check-in. And of course, we're very clear with our patients that we are always available to them 24/7 during their pregnancy and postpartum if they need us outside of those 2 scheduled appointments. And we very often will take those phone calls if somebody's struggling with anything, and or bring them into the office as needed. So the support does not stop after the baby's born. We're right there with them.
It's very generous of your practice, because we know mental health as a whole, right, is a crisis. And specifically in this vulnerable point in a woman's life, it's really what you're doing, both of you, is incredible. So, Michelle, super important conversation that has been happening more lately, but certainly not enough, is birth equity and increasing looking at the increasing infant and maternal mortality rates, especially for women of color. So what is your perspective on this? And this is a big question, right? But what can be done to reduce these inequities?
Yes, I mean, my question, it definitely is probably a work in progress, as I think, as a white woman and as a provider, I know that I carry implicit bias, and, I know that, my patients of color may not feel completely comfortable addressing everything with me. So my focus, when during COVID and we were becoming, even more aware of the inequities all around us racially in this country, I was trying to bring up the conversation with patients and say, listen, I acknowledge that I'm white, and that has a whole host of issues for our relationship. So please know that I'm open to hearing your feedback and input. And so I think that, I need to earn my patients of colors their trust. And I also, know that I may not be able to address their needs. So if there's a provider that I can refer them to that can, then I'm always, looking for that type of referral for patients as well. As far as like prenatal care and infant and maternal mortality in this country, I mean, it's really upsetting that we pour so much money into our healthcare system, and yet the outcomes are so inequitable and honestly just despicable in many, many areas of the country. So there's a lot of room for improvement. I think there's a big place for midwifery care in that. Most countries in Europe that have midwifery as their kind of baseline care for people, and then you have OBGYNs as specialists that come in as needed. They have much better rates of infant and maternal well-being. So I think there's a lot of changes that need to be happening. There's some good bills coming through in Congress. It's called the Momnibus, I believe, and it's a very comprehensive bill around women of color, their rights in prenatal care and outside of healthcare. And I think as white people, we need to be allies and really support these kind of changes, because our society is not, it's only as strong as the weakest members of our society. And if we continue to keep having all these inequities going on and not pouring resources into the people that need it the most, it doesn't say good things about our country and the values that we have. So I don't know if that's a little too political for Northwell, but that's my take for now.
Yeah, we appreciate everything you're saying and doing to keep aware of the issue and what is happening out there, and having those frank conversations with the people that you meet is important. And part of that trust, right? Again, trust and healthcare. We can't do one without the other.
Exactly.
So,
and I
Kathy,
should say,
please.
I was just to say in that I forgot to say that just listening to women is like another hallmark of our kind of care. And I think that in all the stories you hear about a maternal death, there was like a voicelessness about the whole situation. The woman did not feel like anyone was listening to her. And so I think, the biggest thing we can do is just really be listening and hearing and acting on what we hear.
Absolutely, because, we know that we all need to be our own advocates, but we also need to make sure that we are advocating for those who don't have a voice or who do raise something. So crucial. Thank you. So Kathy, I want to go back to Lifecycle for a second. This is also something that has come up in some of our pre-submitted questions, so I expect we will spend a little bit more time on this later. But what do you think is important for women to understand about perimenopause and menopause?
So that's a time when our bodies are going through lots of physical and emotional changes. And people smile when I say this because you can just so relate to it. It's really similar to what happens at puberty. You were used to the body you had, and all of a sudden different things are happening and you're not so comfortable with it. But the main difference is that you only had your pre-puberty body for a few years. And you've had your current body for a lot longer, so the changes are harder to accept. So we help women to understand what's happening with their bodies, with their hormones, their feelings. And if you think of many people going through this have teens who are going through puberty. So if you can just think of all the compassion that you have for your teen going through all this and give it to yourself, it will help. It's a good perspective. So we help them to plan for what's going on now and for future changes. We discuss all the things that can be considered to help cope with those changes. So we're very holistic. So that might include all sorts of lifestyle suggestions for changing, maybe changing your diet, getting some more exercise, or exercising differently. We can recommend herbs and supplements, or even medications, including bioidentical hormones, if that's something that somebody's interested in. So we really tailor our care to each person's individual needs. And that can be a lot of different things. And some people will come in and say, I really feel strongly that I want to go down this path and not that one. And so like, okay, let's do everything we can on the path that you think you want to go down, and let's see if that works. And if it does, great. If not, then perhaps you're open to looking at some things down the other path. So we do see a lot of people at that point in their life. It's a big part of what we do here.
Well, and I can tell from the pre-submitted questions that is almost entirely the topic that they're on. So, I think it is something that we need to address that's not always talked about. And it's so informative for all of us to learn how midwifery practices can assist with that. So I'm going to continue on this, Kathy, if you don't mind. One of the questions we had was perimenopause versus menopause. How do you know which cycle you're in?
Okay, so menopause has a very specific medical definition. It means you have not had a period for 12 months.
Mhm.
So menopause means it's all over as far as periods. Perimenopause is the time, and it can be as long as 10 years in some people, where you start having hormonal changes, but you are still, perhaps not regularly, having some periods. So it's a time when your ovaries are, I like to say, falling asleep on the job. They just go to sleep for a while and forget to ovulate and forget to make their hormones, and you skip a period and you start having some hot flashes, and then all of a sudden the brain screams, ovaries, get to work, and they say, oh, sorry, and then they go back to doing what they're doing, and now you might have a period of time where everything is going normally, and then they fall asleep again, and then they wake up again, and then finally, they stay asleep for longer and longer and wake up less and less until finally they're done. And then we call it menopause when it's been 12 full months.
Excellent. Thank you for that. That's so important to know. So Michelle, continuing kind of on this topic, because this is so much of interest, we got a pre-submitted question from someone who is 49, beginning phases of irregular cycles. So, in Kathy's description, right, the ovaries are starting to get ready to retire. What can they do to best prepare?
Well, like Kathy mentioned, there's a lot of lifestyle things that you can do to make sure you kind of are giving yourself a good foundation. I would really mention sleep as a foundational concept that's so important. I mean, many people in this phase are having trouble sleeping or waking up, at 4 a.m. or something. So there are different herbal supplements and hormone kinds of things that we can do to help encourage sleep. Exercise, that becomes quite crucial for, your bone density and also just your metabolism that kind of slows down in these years. Stress management, like I referred to earlier, and we'll talk a little bit about it more, is just probably the top thing that most people are dealing with. Sometimes you have kids, teenagers, and then you also are dealing with parents that are elderly. So you've got all these different, people that need you to care for them. And so you're not able to care for yourself as much. So being able to really take a look at the amount of care that you're able to give yourself and make it very strategic how you do that, and know that you're worth doing that for. Those would be some of the things that we would start to talk about.
That's beautiful. Thank you. It's the whole oxygen mask thing, right? That women need to remember to put on their own oxygen masks. It can fall by the wayside with all those other caregiving responsibilities. So Michelle, sticking with you for a moment, let's talk about COVID. It's still in our midst. So the fact that it has been going on, the pandemic has been happening now for over 2 years. How has the prolonged stress of COVID impacted women's health? And what can women do to support their mental well-being during these prolonged trying times that haven't quite gone away?
Yeah, it's been quite interesting to, I find myself just asking people, in the middle of it all, and then now kind of on the less, intense side of it, asking people what they've been doing and how they're processing it all. I mean, we saw as a nation, or many countries saw women jumping out of the workforce and heading, back into the house more full time with their kids, schooling and caring for people in their house, and what was already considered quite a full plate of activities or responsibilities that a woman had now kind of quadrupled overnight. And partners were involved too. They had their own share of extra responsibilities, but we did see a large economic burden on the women. We saw all kinds of things in the practice, from irregular periods to a lot of increased mental health, depression, anxiety. We had, I wanted to reference my notes, weight gain, and then just kind of, such a lack of alone time. I know that was a big feeling of women, just never any time for themselves. And so, and we saw such a, you know, people, their normal stress relieving kinds of outlets, like hanging out with friends or going to the gym, connecting with others, you know, in different ways, you know, just was really stymied. And so people just had to resort to finding new coping strategies. So I was impressed with the women that I saw. I mean, people were being really creative with how they started to, you know, identify things that were important to them that they wanted to bring back into their world. I mean, I think in the beginning, we all just didn't even know what we were missing. We were just, you know, kind of on autopilot, trying to just go from one day to the next. But then as time has gone on, now on the other side, I see that people are like, oh yeah, I used to go to the gym and I really liked that. So how can I do that at home? And, you know, and other ways, you know, connecting with family in unique ways, you know, over Zoom or in backyards or things like that. So I guess I would encourage people to, you know, take some time to reflect now on, you know, what was the good about those times and what were the challenging things, what pieces of yourself have you felt like you know, forgot about, or that you've neglected and that you want to bring back in some way. It may not look the same, but, you know, differently. And cultivating resilience in that way. The breathing exercise that we'll do is around resilience, and resilience is basically like the ability to bounce back to life, returning stronger than before, and rather than being overcome by perceived failures, missed opportunities, or issues beyond our control. It's people who are resilient are able to find a way to carry on and thrive. So that's what, you know, I think that we can help people point them towards, you know, in this kind of aftermath of everything.
That's such a great sentiment, remembering that things won't necessarily be the same, but that's not always a bad thing, right? Here we are having this conversation in a format that we might not have 3 years ago, but maybe that's a good thing, and letting people participate in a new way. So it's really nice to focus on the positive like that. So Kathy, what makes choosing a midwife special and different from other providers?
That's probably the question that we're asked more than any other. So I could talk about that for a long time, but I'll make it short.
No, we're ready. We're ready. Bring it on.
So although we do many of the same things that an OBGYN does, we approach our care just from a different perspective. You know, doctors go to medical school to learn how to help sick people get well. And they also learn about how to keep healthy people healthy, but their main focus is on fixing illness. And midwives come at it from the opposite way. When we go to school, we mostly learn how to keep healthy people healthy. And of course, we also learn a lot about managing all sorts of complications, and we're quite able to do that. But we have a holistic approach that really looks at the whole person, as well as their family and their community, all the things that can affect someone's health and well-being. And part of that is really getting to know each person so that we can tailor our care to what that particular person needs. We don't treat everybody exactly the same. And we want to foster a relationship of caring and trust, as we've talked about before, where the patient's voice is every bit as important as ours. We're really a partnership. So I think that although the hands-on things we do may look similar in a lot of ways, it's the relationship and the partnership and the idea that you are basically a healthy person, and we want to help to keep you that way. One of the things that differs is our scope of practice. So anyone who graduates from medical school is automatically a surgeon as well. Midwifery school does not make us surgeons, so that's something that we don't do. If somebody does need a cesarean, we are able to actually do the surgery with the doctor, but as the assistant. And we also don't care for people who are already battling pretty serious health issues and then they get pregnant. So our focus is on basically healthy people and helping them to stay healthy and thrive.
Excellent. That's really helpful to kind of see it that way. So Michelle, I'm going to flip the question on its head, which Kathy alluded to a little bit, but when would it not be appropriate to come and see a midwife for your gynecological or obstetric care?
So like Kathy mentioned, with prenatal care, if you have like a medical condition like diabetes or chronic hypertension that you're on medication, or you've had heart disease, like a heart attack or heart surgery or something like that, those are medical conditions that are going to really be challenged by pregnancy. And so you need a team of experts in those areas that would be able to care for you. So sometimes midwives are in collaborative practices where they work with high-risk doctors. And so, our hospital is not high risk, so we don't have that aspect, but we have the collaborative aspect of the relationship where we do find a happy medium with a lot of different medical things. But extreme things like the heart condition or something would definitely not be a midwife specialty. Gynecological care, again, like if someone had cancer, especially of like the gynecological organs, I would say, I'd want them to have clearance from their team and be in remission, before we would take care of them. And usually that happens, after a few years, and they kind of clear them to go back to regular checkups. So those are a couple examples.
Excellent. Thank you. And Kathy, here's a question that I'm sure is probably your second most asked, right? A lot of people do ask and are confused about how are midwives different from doulas and how might they work together?
You're right. That probably is number two. As midwives, we have a lot of education. We're highly educated and licensed healthcare professionals. Doulas have no medical training whatsoever, and they're not licensed. So we have completely different roles. They're very important, but in a supportive role. So some doulas support women during labor and birth, and other doulas support women during the early postpartum period. Labor support includes things such as massage, suggestions for changing their position, helping the partner to provide support, providing encouragement, advocating for the woman's wishes. And what they do for postpartum includes caring for the baby while mom is sleeping, doing errands or housework, supporting breastfeeding. So it's not a medical role that doulas have, and ours is. So we love doulas, we really do. We know all the doulas in the area, and when somebody brings a doula with them when they are in labor, we love that, because although we provide as much support as possible during labor, and we are, I think another difference between doctors and midwives is I think we're a lot more hands-on during the labor process than doctors are, who often mostly come in near the end when it's time for the baby to be born. But also we make all the clinical decisions that are keeping the mother and baby healthy. So we have that piece that we need to focus on first and foremost. And we also may need to attend to more than one person at a time. But the greatest thing about doulas is they have absolutely no other responsibilities except to pay attention to the comfort of that one woman, and they're present for the entire time. So that is their real strength, is very consistent support for the entire labor.
Excellent. That's really helpful understanding. And it sounds like that relationship, like it complements so beautifully between midwifery and doula work.
Mm-hmm.
Excellent. All right. Well, Michelle, I know we alluded to a breathing exercise for stress management, and I think we're all eager to try it. So
Okay.
We're ready.
All right. Well, I got this. This book is called How to Breathe by Ashley Neese, and it has about 25 different breathing exercises. So you can, if you want to check it out, it's pretty cool. But since we were on the topic of resilience, I thought we could do the resilience breath. And as I mentioned before, resilience is about being able to self-regulate, the ability to be flexible while still having healthy boundaries, having a positive outlook, supportive communication skills, and the ability to see failure as an opportunity to grow. And so this is a breathing exercise that you can do like in the morning to kind of uplift yourself, cultivate a stronger life force presence, and remind yourself that you've got this. So what you can do is if you want to stand up, you stand up really tall with like your hips spread apart, hip distance apart, and like a slight bend in your knees, just so you're like really relaxed. Let your arms rest at your sides. And then you kind of set a practice intention, which is like, something you want to focus or get out of this time. And then you breathe in and out of your nose for a few cycles just to settle into your body. You feel your feet planted firmly on the ground. You feel the breath coming in through your nose and out through your nose. And then you can just lift your arms to your sides and raise them all the way over your head till your hands come together like in a prayer position. And as you do that, you lengthen your spine and just stand up as tall as you can. And as you breathe out, you're bringing your hands down to your heart. So you can do that. We can do that for about 5 breaths. You kind of breathe in as your hands are raising, standing up tall. And then exhaling your hands down to your heart. So as you close your practice, you can remember that you are amazing, that you have been through tough times and you can get through this tough time, and that your body and your mind and your soul have everything they need to create a beautiful and life-affirming life, and that you can go forth in this day with energy and with resilience.
I love that.
Yes, thank you. So I feel so much better. It also gets us to stand up and, if we do manage to fit it in the middle of the day, get our body moving a little bit, something I think we all struggle with. Thank you. That is such a valuable skill. I'm going to bring that to my daughters as well. It's a good reset moment.
Oh, good.
So I am going to open it to the floor. We did answer all of our pre-submitted questions. So if anyone has anything else that they'd like to either throw in the chat, raise their hand, put in the Q&A, we are here for you. And Kathy and Michelle as well, anything that I didn't ask that you'd love to add in, I want to leave that open for you as well. And meanwhile, I'm going to look at the polls as well, because now is a perfect time to kind of share those results, right? While people are thinking about their questions and what's on their mind. So returning to the very beginning, true or false, midwives are nurses. It looks like 1/3 about thought that were true and about 2/3 said that was false. I'll let you weigh in and answer that.
Most midwives are nurses because that was the only route into midwifery for a long time, and many states still require that. New York hasn't required it for a very long time. So you'll find in New York some people who, just like Michelle, went in directly to midwifery without being nurses. So whether you answered true or false, you were probably right for some people.
That's really, it's helpful to know. I think we answered this very clearly. True or false, midwives aren't as safe as doctors. And even from the start of this program, I'm happy to report that virtually all of the responses, right, agreed that that is false. So, and I think this conversation has done even more to help people understand that.
I would just like to throw in that there have been a lot of studies that have shown that for low risk women, because remember, that's our specialty, outcomes can even be better with midwives than with doctors for low risk.
That is important to note. Yeah, as with your focus on the well-being, right? Starting with the well and keeping everyone well. Question 3 was midwives only deliver babies at home, also very much addressed today, but it also looks like people came to us with a good amount of understanding there, that 85% had said that that was false. And as you had mentioned, most of the babies are delivered in the hospital, right? And lastly, true or false, insurance doesn't pay for midwifery care. And there was some misunderstanding here, I'd say. So about a third said that was true and about 2/3 said that was false. So please help us understand.
In New York State, midwives get reimbursed the same as doctors do for OB and GYN care. It's not as even in all the states, but New York does reimburse similarly. So we are a part of every insurance plan that Northwell is a part of, which is pretty much everything.
Excellent. That's great for people to know when they're making their care selections. We do have a question in the chat that there was mentioned earlier of holistic and the blend between holistic and traditional medicine. And Monique would love to hear a little bit more about that, about holistic care, more in depth.
You want to take that one, Michelle?
Well, I can give some examples. You know, so like, well, you know, maybe a urinary tract infection, for example, like people, you know, can come to us for that kind of infection. And yes, antibiotics may be something that we recommend initially to treat that. But if they struggle with chronic urinary infections, we're going to also be talking about various things they can do to prevent the urinary tract infection. There's various herbs that then can help, you know, avoid that. So we might use that kind of blend of both traditional, you know, Western medicine antibiotic use, which has definitely a role, and then also help support prevention of that kind of thing. What else? There's so many things in terms of even just herbal supplements that, you know, like if someone's coming to me, they want to get pregnant, I have some good herbal you know, preparations that I recommend that are evidence-based, you know, things. And like we said too, like, you know, preconception care. We work in conjunction with our acupuncturist in the office for a lot of our fertility patients and body work kinds of things. So there's that blend of all those various modalities coming together.
Thank you. I think
I
that
would say that,
Sorry, Kathy, go ahead.
I would say that one of the areas that we use a lot of holistic treatments is stress, because what does the word holistic mean? It really means looking at the whole person and the whole support system to that person. And so when people are stressed out, they could take a psych med or do all the other things that we know help with stress, as Michelle talked about before. But there's exercise, and there's therapy, and there's all sorts of herbal supplements that can help with the stress that that affects our adrenal glands. For instance, our adrenals can get really, really tired quickly when they're constantly pouring out stress hormones, and there are supplements that can help support that. When I think of holistic, I think of looking at the whole person and their whole support system. So we do that in pretty much every aspect of somebody's care, but stress is a big one.
That's a great reminder that whole is whole for a reason. I see we are just out of time. I cannot thank you enough, Kathy and Michelle. I think that we all learned a tremendous amount today about midwifery and the entire cycle of a woman's life, and how many places we can work together to care for women's health. And to all of our attendees, thank you for spending your time with us today. We hope that you'll join us again. And please, please, please do complete that survey that pops up on your screen. Your feedback is so important to us. And it will also give us that opportunity to answer any additional questions that you have. You can pop that in the survey, just include a way to contact you so we can get you that answer. And if you are looking for an appointment or a referral, that is the place to do it. So we can get back to you. So on that note, thank you so much. And for everyone, have a great time.
Thank you.
Thank you.
Thanks, everyone. Bye-bye.
Bye.